Social psychology is the branch of human psychology that deals with the behavior of groups and the influence of social factor on human behavior. Social psychology is everywhere. It is in your family, in your school, in the hospital, in your favorite restaurant, and in every subject of which photographs. Indeed, social psychology can be found everywhere. It is applied, it is implied.
Depends, no? Kung reconstruction, the plastic reconstructive reconstruction from birth to death. Yun. Kasi yung may mga congenital diseases like cleft lip and palate, they are treated as early as 3 months. Yun naman mga matatanda na may sakit na gusto mong paayos na mukha, even 18 years old, nagagamot namin. So, the age range is vague. So, if cosmetic patients yung magpapaganda, generally 18 to 50 years old. Pero kung reconstruction from birth to death. They have goals They have something in their faces that they don't have dahil hindi nila gusto. So, like, sabi nila, wide yung A nila o kulang yung bridge nila. Maybe kulang ng konti sa self-esteem. Basically, everybody is not contented with what they have. Neighbor's ulam is always delicious compared to your ulam. There's a preoperative evaluation. You should know whether the patient is realistic or not. For example, here comes a patient, she wants the nose of Vilma Santos or the nose of whoever. You cannot give that nose to her because she's totally a different person from that actress. So she can never have that nose. What she has is a nose that can be refined. Yung sarili niyang nose can be refined and improved to something better. But she can never have a nose of another person. So she's not realistic. If she's not realistic, it's better that you don't operate on her. Because she's going to give you problems afterwards. She will never be satisfied. She will always complain, so and so and so. Or you can give her to your enemy. So siya ang problema, hindi ikaw. You should always know how to say no to a patient if you think that patient will just give you problems afterwards. Screening-wise, patients above 40 should be screened for cardiovascular disease like heart problems, hypertension. So, meron yan mga laboratory exams na hinihingi, may ECG, may chest x-ray, and then you ask for a clearance from a cardiologist whether this patient can undergo surgery, yung kung optimal yung health niya prior to the surgery so that you avoid problems. Kasi as a cosmetic patient, you don't want any complications afterwards. If I don't think she's realistic, I don't think she will handle the swelling, and her psychological makeup cannot tackle the stress of the surgery, and she's not realistic, I'll tell her, don't have surgery. You don't need anything. You don't have to do that. Or she just came here for kaway sila nang iniwala siya ng asawa niya, and she wants a boob job. Or she wants to be sexy because yung girlfriend ng asawa niya is sexy. I cannot solve her problem by giving her new boobs and making her doing liposuction, diba? The husband will come back to her if that's the reason why she wants to. Nobody can force me to operate a person. I can always say no. If she doesn't need it, I won't encourage her. Cosmetic. I never encourage patients to have cosmetic surgery. They should come here with a goal na ito yung gusto nila. They don't come here then, magpa-opera ka ng ilong mo kasi pangmukha. I don't do that. I don't do that. They come here with a goal. Gusto nilang, I only follow what they want. And if they ask for my advice, if yung gusto niya and what I want is not pareho, then we go in the middle and compromise. Pero for example, our goals are the same, then that's okay. But I never convinced them to have this cosmetic surgery. Kung ano naman, kung reconstruction, like an accident, the patient doesn't have any choice. Diba? If there's something wrong, kunyari, kulang ng balat, you have to burn, it has to be skin grafted. Then you have to convince them that if you skin graft that burn wound, it will heal faster compared not to having it skin graft. Just tell them the consequences behind the surgery, if it's going to be advantageous or disadvantageous.
In contrast
So
to that,
it's always the patient's choice.
Yes.
You only tell them what you know, give them options, and then they choose. Because that's their body.
Have you ever had patients who became obsessed naman po? Like,
Madami.
so how do you deal with those patients?
I tell them, I don't want to operate on you anymore. You can go to another plastic surgeon for that. I've had relatives who I did surgery.
No.
Except my daughters and my dad.
Hindi po niya kailangan.
Right now, at this present time, not yet. Right now, I don't think I need it. So I'm still happy with what I have.
If ever, sir, but if ever, do you want?
Maybe. I don't know yet. But siguro hindi, I'm not that vain.
How about the media? How do you think they motivate people to undergo surgery?
That's marketing. Our society doesn't encourage us to market ourselves. We don't involve ourselves in commercialism. Hindi kami nagko-commercial. So, iba. But not our society. They discourage us from doing that. It's not, for us, it's unprofessional. Sa kanila, surgery is not without risks and complications. Okay? If they have a goal, go for it. But with the goal that they want to achieve in plastic surgery, there are corresponding risks and complications. You cannot have surgery without that. So be ready. If you want a boob job, be ready for example, there are certain percentages of complications that can happen after a breast augmentation. So, for example, out of 100 patients, there will be 2 or 3 patients who will have some problems. I don't know whether you will belong to the 98% or to the 3% na problema. But there's always a chance that you will belong to that, right? If you cannot tackle the risk and complications of that 3% pie of the persons na mayroong complication, di huwag ka na magpa-opera. Kasi cosmetic surgery is not really needed. It's not a matter of life and death. Hindi naman siya essential to life. Ika nga. But it can make the person become more confident. It can develop her self-esteem. It can even change your life. A small nose job can entirely change the life of another person because nawala na yung pagkatigil niya, yung confidence niya. So, it works both ways. Pero meron naman, maganda na yung ilan. Tapos napilit ng doktor ng pa-opera, nasira, nagkaroon ng problema, nagkapekla. Lalo nagkaluko-luko yung buhay niya. So, meron din mga sad stories. So, kung gusto mo, go for it, but be responsible for the possible risks and complications. Huwag mo sisisihin yung doktor mo. It's the doctor's job to tell you everything you need to know.